So, external rotation with band is used to help increase range of motion, but is also used to increase strength within your rotator cuff. So, this exercise prescription is 3 by 12. The reason is that we do want strength, but we also want the strength to be endurance wise because a lot of times the external rotators are not able to withstand like how much throwing or overhead motion is used for overhead athletes, whether it's hitting a volleyball or throwing a baseball or softball or whatnot. So that's why it's 3 by 12. As you can see in this video, we have it at just neutral, and what the patient does is they rotate their arm when it's at 90 degrees all the way out to as far as they can. As you can watch in the video again, you want to make sure you try to keep your elbow in. A lot of times we put a towel in between here so that the athlete doesn't overextend their elbow out and upper arm out, because that would be not activating the rotator cuffs. It would be activating other muscles. We want to progress this exercise by either getting a higher resistance band or even just doing like a 3 by 15. Again, this would allow a more endurance strength wise than otherwise, but again, 3 by 15 would not would help again just progress this exercise. You could also do it overhead. So right now it's at neutral, but if you want to do 90-90 and have the athlete or patient to have the band go up again with their shoulder being at 90 and then their elbow still being at 90, that would also progress it. But for some people, that would be um, making impingement. And so again, that just kind of depends on the patient and where they're at. You can regress this exercise by only doing 2 by 12 again, or you can lower the resistance band to a not as high resistance. Again, either way can work with that. You can discontinue this exercise if you have like further injury to the shoulder. So sometimes different AC injuries or other like labral injuries, you would not want to do this. Sometimes, again, it just depends on the injury and whatnot. Because again, this is a great exercise for strengthening the rotator cuff, but at times there is injuries that you should not move your um, shoulder in this direction. You can also progress exercise when you want to move to more functional kind of rotator cuff activation and strengthening. This motion is not one you would typically need in a activity very functionally, but it is good to just help strengthen and get that basis.